FDA says no. So, schizophrenia is usually treated with first and second generation antipsychotics. But we hear there is a new drug called cariprazine, awaiting approval by the US FDA. Let's take a closer look. Approximately 1 in 100 people develop schizophrenia at some point in their lifetime. The cause of the disease is not fully understood, but the most probable cause is a hereditary component along with environmental factors. Illicit drugs like marijuana, LSD, or amphetamines can be linked to a trigger for a first antipsychotic episode. Antipsychotics are drugs used to control the symptoms of schizophrenia, which is characterized by psychosis. These drugs can reduce the positive symptoms of thought disorders, paranoia, delusions, and hallucinations, but they have less an effect on negative symptoms characterizing asociality, apathy, and blunted affect. The drug is in the late stage of development for the treatment of schizophrenia, bipolar disorder, and an adjunctive treatment to major depressive disorder. Cariprazine is a unique antipsychotic as it is highly selective for D3 and partially selective for D2 dopamine receptors. D3 receptors have been shown to be elevated in schizophrenic patients. This drug expresses partial agonism for these receptors, further differentiating it from traditional antipsychotics. Partial agonism allows cariprazine to act as an antagonist in regions of the brain where high dopamine production has been shown to cause symptoms of schizophrenia. However, this drug can also act as an agonist in areas where dopamine production is low and often causes many of the side effects, such as extrapyramidal side effects and hyperprolactinemia. This drug acts as an antagonist in areas such as the limbic system, substantia nigra, ventral striatum, and thalamus, while acting as an agonist in the nigrostriatal and tuberoinfundibular regions, commonly responsible for unwanted side effects. This unique effect is theorized to be an advantage of this drug. At saturation doses, cariprazine occupies up to 90% of D3 receptors. This drug has the highest affinity for this receptor of any antipsychotic drug available. Side effects of this drug still include akathisia and other extrapyramidal side effects, given that this drug is also a traditional D2 receptor antagonist or agonist. However, other symptoms such as weight gain, metabolic abnormalities, hyperprolactinemia, extrapyramidal side effects, and QT prolongation are all reduced. The drug also shows minor selectivity for serotonergic 1A receptors. Cariprazine shares many pharmacokinetic characteristics with older, lipophilic antipsychotics. Its receptor occupancy has been measured at 69 to 75% and greater than 90% at 1.5 and 3 mg respectively. It has an extremely variable blood concentration after oral dosing. However, this is common among first and second generation antipsychotics. Peak blood concentration is reached after 3 to 4 hours under fasting conditions, with food having little effect on absorption. The drug is primarily cleared via hepatic metabolism by cytochrome P450, specifically CYP3A4. CYP2D6 also plays a minor metabolic role. Cariprazine has a long half-life at approximately 2 to 5 days for a 1.5 to 2.5 mg dose range. Its metabolites also have a very long half-life of up to 2 to 3 weeks, which means total active drug would take weeks of dosing to attain a steady state. Multiple doses lead to a significant accumulation of cariprazine and its metabolites. The metabolism of cariprazine yields 2 metabolites, desmethylcariprazine and didesmethylcariprazine. Cariprazine's extremely long half-life and active metabolites with longer half-lives proves to be a point of concern, and more long-term in vivo studies need to be performed to evaluate long-term pharmacokinetic effects of cariprazine. Cariprazine's novel and unique pharmacodynamic properties gives the drug theoretical advantages over currently available antipsychotics. Its ability to reduce hyperprolactinemia and extrapyramidal side effects is also positive. However, some side effects are still of concern. Its pharmacokinetic properties, although similar to other drugs, are worrying due to its long half-life and ability to accumulate so easily in the patient. There is a lack of evidence in this field, and long-term studies of potential problems are scarce. While there are many potential advantages and benefits of this drug over existing treatment, more studies are required to fully establish the effect of its pharmacodynamic and pharmacokinetic profile before approval.